help me understand what were some of the tactics or how did you involve patients in this co-creation process? So a lot of innovators don't include this stakeholder group. Sometimes they don't include anyone except for their leadership team involved in the product development process. Those that do include customers or prospects in this process, like you said, very rarely do I hear that the patient is actually being considered, especially early on. So what was that like for you guys?
So we basically, the good news and bad news is that we all were born into healthcare, and the last day of our life, we will be the arms of healthcare more likely than not. So healthcare is in some ways easy to emulate because you are always a patient or a parent of a patient or a son of a patient. So it's not that difficult to ask and receive the answer, whether you're doing a control group or a large group, as to what would be the right way for you to experience healthcare. And, over the years, I've been able to ask that question of groups very, very large, like large populations, statewide, program-wide, and also of the inner circles and the close group. And it always boils down to, 3 key friction points. First is, I need to understand how I can access healthcare. What are my rights and responsibilities and options? And it is difficult to even begin to figure out how to even access the healthcare system. And other than the emergency room visit, which everybody can understand, if you're not in that situation, if that is not the optimal model of care, and it never is the optimal model of care, how do I begin the journey of identifying my needs and identifying the supplier and identifying my rights and options? So that's the first thing, which is what you can call in loose terms, the healthcare administration side of it. Mm-hmm. The second equation that always comes up is, how do I know I'm getting the optimal care? How do I know that I'm doing everything I can to make myself or my loved ones healthier? And how do I know that the doctor is actually doing everything he should be doing? And this is not a criticism of, is the physician capable? It's a criticism of, is the physician and I fully engaged in the dialogue as we should be? And given that my average time, face-to-face time with my physician is measured in seconds, how do I know that I'm getting the optimal care, and what should I be doing, and what should the physician be reminded of that I need to know? So there is that care coordination element, the care quality element. And the third part that scares most people is, who's going to pay for this? What am I responsible for? What are you responsible for? Am I being billed the right amount? How much is the insurance company or Medicare or Medicaid will cover? Should I use my HSA or should I not? There's far more questions than an average consumer has the facilities to answer.